Hi, good afternoon to Dr. Fazila. My name is Zeng Chen from group number 14, and today my group members and I will be presenting on a case study with titled Dermatitis in Animals. So in this case study, we'll be naming and describing the lesions of these three pictures here, and then we'll be presenting on what are the possible differential diagnoses. And lastly, we'll also be describing the diagnostic procedures to confirm the diseases. So this is a list of our group members. Okay, so I'll be describing this picture here. So as we can see, the location of this lesion is located proximal to the elbow joint at the lateral surface of the left forelimb. And this lesion there's multiple focal and it is erythematous. So we think this is a nodular mass, and we also think that this is also a primary lesion in this patient. And next, I'll be describing the lesion of this dog here. So we can see that there's a moderate size palpable hyperemic mass located unilaterally at the right medial thigh proximal to the knee joint. So for this mass, we also think that it could be a primary lesion. So I'll be passing the next description to my next group member. Thank you very much.
Hi, Assalamualaikum and a very good afternoon. My name is Fatia Betty Sohaimi with matric number 194944. So today I'm going to present about the picture number 3 I will describe and what is our differential diagnosis for this case. Alright, let's see. Okay, so for picture number 3, we can say this is a primary lesion. Is a tumor here, and you can describe as a severe necrotizing mass here with a very blackish pigmentation at the perineal area, at the perineal region, up to tail base of the region. So you can see it's very clear here. So from the 3 pictures that we are summarized and came out with these 4 differential diagnoses, which is the first one we say that this is a cutaneous epitheliotrophic lymphoma. Second one is a cutaneous melanoma, and the third one is apocrine adenocarcinoma, and the fourth one, our differential diagnosis, is transmissible venereal tumor and known as TVT. Alright, so I pass to the next presenter. Thank you.
Assalamualaikum and hello everyone. Moving on to our diagnostic procedure. For our first differential diagnosis, which is cutaneous epitheliotrophic lymphoma, a definitive diagnosis is always based on histopathological examination. So, a full thickness skin biopsy section is needed for a definitive diagnosis. What we are expected to find are a characteristic infiltration of lymphocytes along the lower layer of epidermis or mucosal epithelium. We can also see this lymphocytic infiltration at adnexal structures, including the hair follicles wall and apocrine glands, and these expected findings are considered diagnostic.
My name is Chong Chun Hong with metric number 192849. So now I'm going to talk about diagnostic procedures for cutaneous melanoma. Cutaneous melanoma is a cancer that starts in the pigment producing cell in the skin, which is the melanocyte. It occurs in dog and is malignant in nature. For the diagnostic procedure for this disease, we will normally do a fine needle aspiration cytology, but biopsy for histopathological examination is essential to evaluate its malignancy potential. There are few expected findings when we use fine needle aspiration and cytology. We will observe round epithelial or spindle cell with prominent nucleoli. This cell contain melanin pigments with variable amount of gray cytoplasm and also with moderate to high nuclear cytoplasmic ratio. Other than that, we can also do biopsy for histopathology examination. The expected finding in the histopathology examination are asymmetry and poor circumscription of the lesion, and there will be suprabasal melanocyte and with hair follicle involvement and absence of maturation and necrosis.
Hi, my name is Malik bin Akbar Khan, matric number 189637, and I will be presenting the diagnostic procedures for our third differential diagnosis, which is transmissible venereal tumor or TVT. So the diagnostic procedures that can be taken are a fine needle aspiration followed by cytology and a biopsy followed by histopathology. So for the cytology, the expected findings are the TVT cells to be round or oval in shape and often contain mitotic figures with chromatin clumping and one or two prominent nucleoli with multiple clear cytoplasmic vacuolation. And for the biopsy and histopath, the histological findings that we can find is that histiocytic cells, the components of the cells, grow in compact masses or confluent sheets, sometimes growing in rows or cords or loosely in delicate stroma. So as the tumor mass increases, the cells become more tightly packed and irregular in shape, and as fibroblasts begin to appear. And that's from me. Thank you.
Hi, Assalamualaikum and very good afternoon. Thank you to Malik. So I'm now going to proceed the presentation with our last but not least of our differential diagnosis, that is apocrine adenocarcinoma. So in dogs, we usually see this in the perianal area, which is where the anal sac glands are. So therefore, we call it as an anal sac apocrine gland adenocarcinoma. In this case, we've suggested a few diagnostic measures, which are FNA and cytology, and the second one is biopsy and histopathology. So expected findings that we can find from the cytology is that we can see typical sheets of clump cuboidal epithelial cells, as we see in the image here. It is bluish in color of the cytoplasm with distinct cellular borders that are visible. And also we can see epithelial cell forming a distinct acini, which is indicated by the arrow with a darker blue in color. So that is what we are expected to see in cytological smears of the FNA. Thank you.
Hi, my name is Ng Kian Kai with metric number 193054. So before we end our video, I would like to do a brief summary about the cases today. So when we encountering problems involving single or multiple cell mass on the superficial of the patient's body, the procedure that we usually follow is basically similar to how we diagnose a tumor. So what we did here is we actually do biopsy, we do fine needle aspiration, and we actually get the samples of the cell mass to do cytology or histopathology. So when we can obtain the cell and do a microscopic examination, the things that we have to look for is the features of each type of tumor cells. So you can see, like in the case of cutaneous melanoma, you can have round epithelial and all the spindle cells. prominent nucleoli and melanin pigment, and so on. So my point is, when we are going to diagnose a tumor or even a visceral cell mass, the thing that we do is always we look for the prominent feature at the cytological level or the histological level. When we follow this as the rule of thumb when we we are doing diagnosis for cell mass, we can confidently get to the very correct diagnosis. So I think that's all from us. Thank you.